Okay, we're going to be about another hour or so. Try to get you out a little bit early so I can get to the airport. Yeah, I'm flying home. Linda promised me we'd make it in time.
Where's home? What time is your flight?
Home is Providence, Rhode Island.
Rhode Island.
Yeah.
What time is your flight?
6:05. Strength, not weakness. Okay. So we're going to talk about recovery capital, but before we do that, let's process what we've talked about already. Thoughts, comments, concerns, agreements, disagreements. Where are you? No? No one? I wasted my time? Okay. Please. Yeah, go.
I mean, I don't know. I guess I think that while giving people choices is one thing, and recovery says that, well, let me just say, I believe that if you're going to be in a recovery process, then you should be abstinent from all drugs.
Okay.
And substances. So I just don't buy the whole thing about, you can stop shooting dope, but then it's okay for you to drink alcohol.
Mm-hmm.
Or you can stop shooting dope, and it's okay for you to still smoke marijuana. I just believe that recovery is recovery.
Sure. And so what she's saying is, what's your name?
Stephanie.
Stephanie is saying is that it's her belief that abstinence is required for recovery. Abstinence from all substances. It's really important that we know that about ourselves, okay? Not that we change our opinion or belief, but that we know that and let people know that that's where we're coming from. This is my recovery model, okay? I'm not saying you have to change what you believe, okay? But and that's why we have clinical supervision, okay? So you or anyone else can take your belief system and your interactions with a recovery into that discussion and see how it's working, okay?
But not that I'm going to impose what I believe on another person. So, I mean, because my bias is exactly what it is. It's mine. So
yes.
I understand. Okay. I understand that in some instances, my bias is that I believe that you should be abstinent from all drugs.
Okay.
But if that's not where a person
How does that affect your relationship with recoveries that you work with?
It doesn't.
It doesn't at all?
It really
Okay.
doesn't, because, again, it goes back to what my values are.
Okay.
My values may not be the same as yours,
Yeah.
but yours are no less
Good.
important than mine.
Okay.
So I understand
Excellent.
that.
Excellent. Anyone else comment on the first bit? Yes.
Well, what I'm hearing is that there's a difference in the terminology and the lingo that we're using, and that the terms that, let me speak for myself, terms that I have been using, you're saying not to use addict or alcoholic, now refer to that person as a person in long-term recovery, which is not new, but I'm saying it's something that is more professional, so that's very beneficial. The term recovery, not new, but still that sounds better, and when we're addressing that person. And then you say use substance use disorder and not substance abuse.
Yes.
So these
Those
are
are my
terms
recommendations.
that while they're not while they're not new, I'm not going to sit here and say that I have been using them consistently, because I haven't.
Right.
So this is the information that I'm taking from here,
Good.
and it's very beneficial. And I think that because what I recognize is that a lot of times terms are used interchangeably. Clean, sobriety, abstinence, recovery, dependence, abuse, addiction, and all of that. And any given time in our field, we hear all those terms used, but when there's a general consensus across the board and we're all using the same language, I think that when we're dealing with the person seeking help and coming into recovery, no matter where they go, when they hear those terms being used over and over and over, then they can relate, and it seems like we're all on one accord.
Sure. So one of the things about not using client and patient is that those tend to be describe hierarchical relationships.
Right.
Okay?
Right.
And what we're aiming for here is a partnership. Okay, so recovery is more of a neutral term that doesn't convey, whether on purpose or not, that hierarchical relationship. Okay. Faces and Voices of Recovery in 2004 did a focus group survey, large focus group survey around the public perception of what is recovery. And one of the important messages that came out of that was that we need to use a different outside language than inside language. So if we're using our in-house language, clean, sober, this, that, people don't understand that. Even if I say I'm recovering, what, you've been doing this for 26 years and you're not done yet? You know? Really, so helping to create a different public perception of what this health issue is and how we're dealing with it is really important. So I appreciate your bringing that up. Anyone else thoughts about the first part? Okay. So let's talk about recovery capital some more. It's the internal and external resources that I can bring to start and continue my recovery. Again, these may be resources that I don't know I have or I have yet to gain that I need. Okay? To start and continue my recovery. Again, these may be resources that I don't know I have or I have yet to gain that I need. Okay? And I've said this over and over, but I think it's really worth repeating that we start the conversation by asking what's right with you, not what's wrong with you. Okay? Even that, to begin to frame for the recovery, that's the important place to start the conversation. Okay? And I know that we have forms to fill out and we have procedures to follow. Okay? Some of what we may need to do is go back to our agencies and advocate for a change, some changes in how we do this. Okay? But asking the question, what's right with you, not what's wrong with you, is going to elicit a very different set of responses. So recovery capital, someone was asking what is recovery capital? So it could be all sorts of things. It could be self-esteem, self-actualization, self-efficacy. Everyone know what self-efficacy is? It's the I can do concept. I can. Because so many of our recoverees come before us with a sense of, I can't. I've tried, I can't, I'm a mess up. Okay? So having a sense of I can is very, very important. It's essential to this process of change. Because that's going to impact on what the recovery thinks about her or his ability to move forward with this and to carry it beyond the 9 hours. Okay? Schooling, education of some kind. Transportation is a recovery capital. Rejoining the community, having opportunities to volunteer and be a regular citizen. That joining a choir. I don't know how many patients I've had in the past that have said to me when I talk about participating in groups, they say, I belong to my church choir. That's a great thing, okay? It's an asset. Childcare, support groups, family, work, medical health support. These are all different types of recovery capital that we want to be measuring for people. So most of my work as a clinician has been in the publicly funded sector. So I tend to work with folks at that far right end of the spectrum, okay? But every once in a while I do fee-for-service work, and that's generally for an agency that takes insurance. Well, in order to have insurance, you probably have a job, okay? Which means you may have your own transportation, an intact family, all sorts of resources. And I have to shift gears significantly in how I look at, approach, interact with someone in that environment than when I'm in a publicly funded environment, okay? So we could break up the discussion about recovery capital into 3 segments. And this is just for the sake of discussion, okay? And it's a way of breaking them down that you might want to, you could use as to build an assessment tool. So personal, the ones that I have, and we'll go into this. Family, social, what might be called kinship capital. And then community. What's going on with my community? Do I live in a community that supports recovery? Okay. And we'll talk about more of that in a minute. So the assets that someone brings. And it's not just the physical, financial ones. Okay. It's the looking at this physical. There are all sorts of things. My financial assets, whether I have shelter that supports my recovery, clothing, food, transportation, some of the basics. Okay, Maslow's hierarchy. If I'm worried about what I'm going to eat tonight or where I'm going to sleep, I'm probably not going to be thinking about getting those support meetings. Okay. So understanding some of the basic needs, and not just housing, but recovery conducive housing, recovery supportive housing. Okay? Then there's this human side of it, those internal pieces. What's my sense of hopefulness about what's going on? Jeff mentioned earlier about AA and hope, and that really is one of the strong characteristics of AA, that it builds and helps people's hope to flourish. What are my interpersonal skills? How well do I interact with folks? Again, I'm not pushing the AA model. There are some aspects of recovery that have developed around AA and in AA that are very helpful. So the process of re-socialization is something that it tends to do well. Because many of us come into recovery not having good socialization skills. Some of us don't have any. Okay? So it's an environment, and there are others, smart recovery, women, mutual aid can really support interpersonal skill development. Okay? My social relationships, my problem-solving skills, my self-awareness, my self-esteem, my self-efficacy, those, the senses of self that change. And that's part of that second characteristic that we were talking about from the Betty Ford Center, when they said personal health, okay? That's all of this stuff. My knowledge, my sense of meaning, meaningfulness in life. There's been a fair amount of research on this. Meaningfulness in life is a key characteristic of sustained recovery. Whether I perceive myself as meaningful. So the example I use with folks, my last night of drinking, I had gone out to someone to celebrate a birthday, and I got home about 11 o'clock, and I was quite intoxicated and was glad to be home because now I could drink the way I really wanted to, by myself. And as would often happen, the depression came on. And I was quite intoxicated and got to a place of thinking about suicide. And I called some people up. I was calling them up to say goodbye. And two of them showed up at my door and put me to bed. And I began my recovery after that. But early on, I described that moment as feeling hopeless and helpless. Okay? And then after a while, as I lived, and thought about it, the word I would use was uselessness. I felt useless in that last moment, sitting in that chair. That's what overwhelmed me. And in the last few years, it's come to look like meaningfulness. That what overwhelmed me was a sense of it didn't matter whether I woke up to another day of my life. It didn't matter to me, didn't matter to my family. This is the way I was interpreting it, okay? I felt meaningless. And that's the big thing that's changed for me. No matter where I go, there I am. I mean something to me today, and therefore I can mean something to you today. So this sense of meaning is highly important as a measurable change for recovery. So kinship relationships, my intimate, my personal relationships. And that intimate doesn't necessarily mean sexual, okay? Family and kinship relationships and the broader social network that I have. These can all be recovery capital. Does my family support my recovery? So another quick story. 3 months into my recovery, my sister was getting married and I was giving her away. And I was still doing my 90 meetings in 90 days. And there was a rehearsal party the night before the wedding. And I was very conflicted. And I don't think I can still tell this story 26 years later without getting overwhelmed. My brother-in-law, my future brother-in-law, said to me, please go to your meeting, because if you don't go to your meeting, we won't have you. You think that's recovery capital? Okay? And so many people don't have that. Okay? So this sense of not just having family, but having family that believes in what we're doing and supporting it. Okay? And we know that for a lot of our recoveries, it's a negative. It's not even neutral, it's a negative. Okay? So figuring some of that out. And do I have social relationships that will support my long-term recovery? You know, we talk about people, places, and things. People. Okay? Disconnecting with folks that were toxic for us, problematic for us. Okay? Well, that means building new social relationships. And if I have a problem with social skills, that's going to be difficult. My community recovery capital. What is the community like in terms of supporting my recovery? What does stigma look like in my community? How does it show up? How people think about and act with, react to persons who need recovery or who have recovery. Visible role models. That's why this faces and voices thing is so important, so that people can see and hear this is what recovery could look like. Okay? It's really important to have these role models. Are there community resources? What about self-help groups, mutual aid groups? Okay? And other kinds of recovery support systems. I don't know. Get to a particular slide. Well, maybe it wasn't here. There it is. Okay. We'll go back to the others. So there's a recovery community center I mentioned before that started just outside of Providence. It started a year ago, December, so that's about 20 months ago. Do you believe that number? They have had more than 100,000 visits in 20 months. 100,000 visits. They had a block party cookout 2 weeks ago, 700 people from the recovery community, okay? Putting a face and a voice, a public face and voice to recovery. That's what communities need. Let's go back. Okay, so when we talk about recovery in the community, what resources are available? How does the community think about recovery? Is it an important life element in the community? Recovery support services, and this is the concept that Linda and the Danya folks and I first started talking about for this presentation. Peer-based recovery support. Peer-based recovery support. Is the process of giving and receiving non-professional, non-clinical assistance to folks who need support. Non-clinical, non-professional services. And they might be called recovery coaches. They're not called sponsors. Jeff Jeff said sponsors. That's not the same thing, okay? They might be recovery support specialists, recovery coach, recovery navigators, okay? They're not sponsors. Sponsors belong to a particular pathway to recovery. What kinds of things are involved in recovery support services? Well, we could be helping folks develop the skills that are important, particularly for recovery. Things like meditation, yoga, social building groups. The Anchor has yoga classes. It has a group for folks who have other mental illnesses to come in. They have a spirituality group. They have a group for the LGBT community, okay, to come in and talk about recovery and provide support to different folks from different communities. Okay? Sober social activities, creating opportunities for dances, card games, karaoke night. They have karaoke night at the Anchor. Okay? Fun social things that people can do without the use of alcohol or other drugs. How do I become a leader in this community? How do I build my leadership skills? The recovery coaching and mentoring piece. Groups of various kinds that I mentioned. What are those other connections to other recovery capital pieces? Okay? Housing, food, clothing, transportation, etc. And general skill development. Facilities, the Anchor has several computers that people can go in any time of day and look for jobs. Okay? It's there. Okay? So distinguishing these peer recovery support services from professional services. So professional services are provided by individuals with formal education in a clinical medical setting. And we were talking about this earlier, about folks being trained and credentialed, okay, from a professional side. So treatment, paid, professionally guided, time limited, and involves therapeutic or medical interactions. This is not peer services. This is professional services, okay? It's also not mutual aid like AA, NA, any 12-step or other mutual aid group. It's not in a group setting. It's not based on the experience of being in that particular support group, and it's not based on the beliefs and practices of that particular fellowship. Okay? So while peers may come out of these various pathways to recovery, once one is a peer, one is not selling that pathway in particular. Does that make sense? Okay. You move up to a whole different level of what it is you're sharing. Okay. When are these services provided? Well, hopefully in the whole system as it goes around. Okay. We might provide them as part of the initiation of recovery, or when in the early stabilization phase, maintenance, further on in life, and to actually build what Bill White calls an enriched recovery, okay? Or early on to keep folks out of the system. Okay? Self-advocacy. There are some very few studies, and I'm part of a research center, so pushing for folks to look at doing more of this, around the role of self-advocacy in sustaining recovery. I'm not here. I believe that, and I'm hopeful that the hypothesis will prove true, that the more I am comfortable speaking on my own behalf, the more I strengthen my recovery. That I think it's like a yin and a yang piece, okay? That being public enriches me, and the more I'm enriched, the more I'm willing to speak and be open, okay? but thinking about self-advocacy as an important element of helping folks move forward in their recovery and developing a richer life. Getting folks in recovery to speak out on public issues, to go before a legislative group and talk about the need for recovery support services. Okay? Faces and Voices of Recovery has a program that's called Recovery Voices Count. Have any of you heard of that? Okay. This goes on during general elections. It started in 2008 in New Hampshire during the presidential election. This is a civic engagement program where the recovery community teaches other folks in the recovery community about voter education. It does voter registration and gets out the vote. Okay. The recovery community develops questions and comments about issues that are important to the recovery community and asks them of candidates. Okay? Puts recovery out there in public on the table as one of the important social issues that candidates need to consider addressing. Okay? It won't happen if we don't do it. It's part of our self-advocacy and our re-engaging ourselves in the community. By our silence, we let other people define us. Yes?
This is the first time I'm hearing of this. Is there any way like every program would know about this? Because there are some patients who wants to be involved in something like this. They don't know, and I don't know.
Yes. If you go to Faces and Voices of Recovery.org, all one word, Faces and Voices of Recovery.org, you can get all of this information. Okay? Peer support dynamics. What is it that we want peers to do? Well, first of all, demonstrate that this goes back to the self-efficacy piece, that what may appear to be impossible is possible. I'm an example that it is possible. Now, your circumstances may not match what mine were when I came in, but I'm still an example of possibility. Okay? I'm a living demonstration of recovery. My recovery, not the recovery, but I'm an example. Okay? That's what a peer does. Okay? And then also role models how it's done. What did it take to get here? What do I do now? Okay? What are the supports I needed? What's changed? How did I build my recovery capital over time? Okay? That's what a peer can do. Okay? Because peers are experientially credentialed. Okay, we talked about professionals being credentialed and licensed. Bill White uses this term experientially credentialed, and I think it's a great way to think about this. Okay? I have walked in your shoes. Okay? And now I can share that experience with you. Okay? So the peer piece and the experience piece are very important. So I mentioned the anchor, and I can give anyone who wants more information about that, come up and visit us. It's really a wonderful place, and we're getting ready to open the second recovery center in Rhode Island. Okay. So. Oh, let me go back. There are about 25 recovery centers in New England. Vermont has 11. There are a couple in Maine, 3 in Connecticut. I forget the other 2. None of them looks the same. Okay, the ones in Vermont started out as AA clubhouses, so they tend to be sort of drop-in centers. Okay, the ones in Connecticut were very professionally developed, and they do lots of telephone outreach and really strategic supports for people's recovery. Okay? So each one of them, they are organic because a recovery community center is owned and operated by the recovery community. okay? So organically, it takes on the resources and strengths that are in that community. The anchor is changing every day because someone will come in who hasn't been there before and say, ooh, can I do a yoga class? And ooh, can I do this? Yeah, sure. Okay. So depending on what the recovery community has available, that's what shows up. When we talk about these recovery support services, again, for the sake of discussion, we can break them down into 4 different areas. So, emotional supports. Having people who can back me up, okay? Support me emotionally when I'm going through the difficulty, because we know that early recovery is probably not a smooth ride, okay? So in the rockiness of that, to have folks who can normalize the process and provide support. Okay? Those folks who affectional, my hug community, if you will. Okay? Affiliational, do I have community supports that I'm affiliated with? My religious or spiritual connections, my faith connections in the community. My schooling. All of those, what am I affiliated with that will support my recovery? And then informational. How do I get a job? Where do I get daycare? How do I get food stamps? Okay? How do I take a college course? All sorts of things. The coach does a number of things. Okay? The coach can be a guide. Again, that experientially credentialed piece, okay? Be a guide. I've been there ahead of you. I can show you some of what happens. Okay? It can help connect to, and this is the case management piece that we were talking about this morning, actual services. What's out there in the community that we can help this person in early recovery use to sustain that recovery? And finally, not just knowing this, but making the connections. Okay? We were putting together a proposal in Rhode Island and talking about peer escorts for people going to a doctor's visit or going down to register a car. Someone who goes with you, just to go with you, to do the warm handoff, to make sure that you make it. Okay? Those kinds of supports are really important. So the skills and roles that people play, various ones that are inherent in this kind of a relationship. So helping restructure one's life and helping to set realistic recovery goals. Being a listener, sharing one's own experiences. These are part and parcel of the peer, experientially credentialed person's role. And the role, this is actually the last slide. The role of the recovery support person is not to be the expert and lecture. Okay? The role is to be a partner. Okay? Creating this healthcare partnership so that the person who owns and carries around the recovery is the recovery. Okay? Not the person who's guiding them on the way. I think that is, yeah. So, we are going to be able to get out of here on time, but I'd like to offer some opportunities for questions, comments, interaction. There's been a lot of information given to you, at you, with you today. I'd like to process some of it. Yes?
Well, one of the things that you pointed out to ask what's right instead of saying what's wrong, it takes me back to the training of doing assessment from a strength-based perspective. So it's like we have a lot of information in the helping profession and in different areas of the helping profession, And it's like we're recycling information, and then we're coming back now for the addictions or behavioral health care to do a strength-based assessment. Because strength-based was taught back in in the early 80s when it came to wraparound services. And so now we want to take that technique and bring it into the addictions as a strength-based. And so that's what I hear, because when we start out assessing what's right, then we're starting out from a strength-based perspective.
Yes.
Yes.
So what may appear to be starting out here,
Right.
one could actually be starting out here.
Yes. And
Okay.
it's good.
Yep. Yes.
How do you all help, like for the homeless population, how do you all help build resources or support for those individuals?
That's a key issue that we're still working on. It hasn't been totally resolved. There are two pieces of the housing issue that we need to think about. One is housing for people who have substance use disorders, who need some sort of recovery supportive housing. Okay? Then there are folks who need housing, who are homeless, who also have substance use disorders and maybe other problems going on. Those are two different systems, okay? The problem with both of them is that they don't necessarily provide the kinds of support that people in recovery need, okay? So we're getting better numbers on what's available in terms of housing, but not necessarily the congruent services and support that need to go with that. Again, I think in part it goes back to the by our silence thing. Unless we continue to speak up about what services we really need, it's not going to happen. Okay? So yes, housing is important. There is a new organization, National Association of Recovery Residences, NARR. National Association either of or for recovery residences, okay? And so they're recovery residences, yep. So they're trying to begin to build standards around this kind of thing, the how-to of financing and supporting these kinds of things, so that there is a movement to organize better these efforts, but there's still a lot of work that needs to be done. Others? I mean, I'm going to keep you here for a while anyway, so,
Well, I think it's important too how it's being broken down when we're talking about working the recovery maintenance or the recovery process into, like, because when sometimes some of the individuals that work in the field are in recovery. When we say support systems, we're talking about family. We're talking about your church. We're talking about your significant people that you have in your life. We're talking about what you are connected with. There are a lot of boat rides that are done here in Baltimore. You're from New York then, right?
Rhode Island.
Rhode Island, okay. There are a lot of boat rides that are given here, a lot of conventions that are given here, a lot of services that different home groups have when it comes to holiday time. They're around the clock, 24/7. There are a lot of activities that support maintenance of recovery. And I think it just needs to be, again, put out there more in Baltimore, how the recovery community is, it's phenomenal here. That a lot of activities do go on. And individual food, feeding, places to stay.
Yeah.
And it is all important, and that's all a part of helping a person with their recovery maintenance.
Yes.
Yeah.
Yes.
I was just gonna say, in Maryland though, it's not just Baltimore. There are people in recovery across the state, and there are not those support services in the Eastern Shore or, in the Panhandle, places that aren't as, that are more rural, that we need to be able to reach out to. But
Sure.
It's not,
Yeah,
we're
services
struggling
do
all
tend
over
to
the
be,
place. And
services do tend to be stronger and more diverse within the urban centers. So.
And that's what I'm talking about, it's not there, but that's when you're talking about us not being silent. If you only have 2 or 3 out there in the rural area, then it takes that 2 or 3 in the rural area to say, hey, look, we need to develop these services here in our area. And that's how it gets started in individual states, cities, counties, no matter where you live. It takes us not to be silent. It takes us as professionals to say that we are in recovery too. This is what we can do. You know, no matter where we are, it just happens. So in Baltimore, a lot of people do verbalize the need, the social activity, you know, where to hang out all night long. Some people don't want to go to bed at night. You know, they still got that lifestyle. They want to be up all night long. So they have meetings all night, you know. And it's a matter of the churches that open the doors to this recovery community, you know. So, you know, I would suggest that if it's a few of y'all in that area, you know, we got to not be silent in our communities.
So what are you going to take with you today? Yeah, question?
Well, you know, one of the things I thought was interesting, and you emphasized it, was that in respect to the recovery coaches, is that when they started it here in Baltimore, when you mentioned that the recovery coach is more of a partner as opposed to a sponsor, and I think initially the recovery coaches here, I think it was kind of like overstepping those boundaries and it turned into more of a sponsor as opposed to being that partner or that role, you know,
Right.
working together.
The sponsor is trying to help someone stay on a specific recovery path.
Right.
As opposed to the wider recovery.
Right, right.
There was something I think too, y'all, that is very important, us as administrators, is the families of recovery persons that are in recovery. The families need to speak out, you know, not just Al-Anon. You don't have to just go to Al-Anon or Ner-Anon. You know, we need to encourage the families and friends of the person that's in recovery to develop recovery activities and that kind of thing, to socialize, because we got to remember that they just need as much education and support in recovery as much as the person who is recovering from that type of disorder.
Absolutely.
And I think a lot of times family members and friends are kind of not focused upon as part of that recovery support maintenance process.
I think you're right.
Yeah.
Did you have a hand up over here? No. So what are you going to take with you out of today? What are you taking away? Tell me I didn't spend all this time for nothing.
Well, I'm going to teach my staff more strength-based assessments, because
Okay.
I do know about strength-based assessments. So I think when I do my clinical trainings, we're going to look at strength-based process.
Great.
That is not a cookie cutter
right.
remedy. Everybody doesn't recover at the same pace or by the same methods.
Yes. Good.
To
Good.
be more open-minded and that treatment can be flexible, a little more flexible, because instead of the closed box, you know, the standard treatment
Mhm.
areas that we used to providing, be a little more open.
Be more
open-minded.
open about it.
Mhm.
Excellent. Okay. Yes.
Use terms like substance use disorder,
Yeah.
recovery,
Yeah.
and recovery capital.
Very good. Very good. I want to come back and hear those words being used more.
And you know what? I teach at a university. I teach the courses in this field at the university. And I will start using that lingo
Great.
and teaching that also at the university where I teach in this field. To
Excellent.
start using that recovery capital and
Yeah.
more so, because the textbooks are kind of like in the old school.
Oh, yes.
You know, so I will take this approach as well and teach it at the university where I teach.
Can you also say drug-free urinalysis results instead of dirty? Because it has a negative.
Yeah. Words like clean and dirty.
Dirty or bad, really.
Well,
Well,
they're
they have
hurtful.
bad connotations.
Sure, think about the connotations of them. So to use a negative or positive urine screen.
Yeah.
You know, those sorts of things.
And
Yeah.
also, I'm going to encourage my clients to be their own best self-advocates.
Great. Great, yes.
Nothing else I'll take with me that we talk about it a lot here, but just how important those community resources are in terms of your development and looking and reaching for a state of wholeness and wellness.
Yes. And it
Connected
all
those
helps the
services.
community own recovery more, recovery as a concept.
Yeah.
You know, and engage in that process. What else? Janet, what are you taking?
I am taking just the whole, where is everybody laughing?
She's been very good this afternoon. Let's give her a round of
No, I'm just gonna take the whole idea of recovery and the fact that the recovery is the person that's going through the process. We're there to help guide.
Great. Anyone else? Okay, thank you very much. It's been a pleasure to be here with you. I hope I was provocative and you take some questions away with you. So, thank you very much.
Thank you.